obesity, diabetes, hypertension. These conditions are contributing to more deaths in the United States today than any other cause, and the numbers are rising. According to the CDC, 1/3 of all Americans are obese. Diabetes affects 1 in 10 people in the nation today, with the number expected to triple by 2050. And 67% of diabetics report taking prescription drugs for hypertension. And these are the leading causes of kidney failure in the U.S. today. But is too little being done too late?
Diabetes is the most common cause of end-stage renal disease and the need for dialysis. Hypertension comes second. Most common cause of diabetes currently in U.S. is obesity. This particularly applies to type 2 diabetes. These days we're seeing the obesity starting in early childhood to early adolescent life. Therefore, the onset of diabetes is now at a much younger age. What used to be a disease of older population above 60s now is a disease of younger population. This will have a tremendous implication in the level of care, the amount of cost that it represents to the federal government and local and state authorities. Currently, they estimate that about 20 million Americans have diabetes. 7 million of those don't even know that they're diabetic.
With nearly 80 million Americans currently considered pre-diabetic and obesity being seen at a much younger age, the need for earlier intervention is crucial.
I believe that type 2 diabetes is perhaps a modifiable illness where lack of exercise, sedentary lifestyle, wrong choices in regards of high-calorie foods are leading to worse obesity at a younger age. So perhaps starting programs from the schools where you can have an audience that you can train from early age, significant educational programs throughout the school, the kind of food they provide to the children, as well as continue to provide community education through churches, through local, state, and federal agencies to reach the population is what needs to be done here.
As the population acquires more and more cases of diabetes, hypertension, and most notably obesity, the number of people in need of dialysis and transplant will only increase. Yet there are already significantly more people in need of a kidney than donated organs available each year. As a result, 2011 10 top health concerns cited the large number of dialysis patients who die each year waiting for a donor.
The kidney wait list grows much faster than the donor pool does. The donor pool has remained stagnant for many, many years. If you take all comers on dialysis, the average life expectancy is about 5 years. When we evaluate our pre-transplant patients, we tell them that they should expect to wait 5 to 6 years for a transplant, which is somewhat of a paradox. Live donation could significantly impact this wait time. This public education on live donation needs to start at the level of the healthcare provider and his ancillary staff, because they are the first ones to interact with the patients in need and their families.
Perhaps like no other patient, those in need of an organ transplant depend on the altruism of others. The CHRISTUS Transplant Institute in San Antonio, Texas, is dedicated to promoting awareness for the need of an expanded donor pool for patients in end-stage renal disease.
CHRISTUS Santa Rosa works very closely with our OPO and UNOS, the United Network for Organ Sharing, to identify any candidates that might be potential donors and to coordinate the activity of the OPOs with regards to cadaveric donors.
In a state where the average wait time for an organs donor is among the longest in the nation, it's a mission that is running against the clock.
I don't foresee the deceased donor pool growing. It hasn't grown in many years, and people are actually living longer. I think the only answer to the discrepancy between the need for transplant and the supply is live donation. The long-term outcomes are much, much better in live donor transplants. The patients get their kidneys faster, and the kidney lasts longer, and the patients tend to live longer as well. And the only way that people are going to increase their willingness to donate is through public education. There's a wide misconception about long-term effects of donating one's kidney. Many people believe that it will increase their risk of going on dialysis or having blood pressure issues, or some even think that it will affect their incidence of diabetes. None of this has been shown to be true. There's no change in life expectancy. There's no change in incidence of end-stage renal disease.
For Ronaldo Orta, who has struggled with diabetes and kidney failure, receiving an organ from a living donor saved him from years of dialysis and saved his life.
I waited 6 years and 9 months for a kidney. My daughter was the one that gave me the kidney. Since I had it, it's pretty good. I got all kinds of goals and plans that I'm going to try to accomplish within the next few years. Feel good. Feel good.
For Lenore Mata, the experience of donating one of her kidneys was a profoundly uplifting and life-changing experience of her own.
We were on the donor list for 7 years, and initially you think, oh great, you know, you're on this donor list and it's just a matter of time, but when time seems to continue to pass and every year you don't have a kidney come to you, and then at that point you realize something has to be done. So, of course, I volunteer myself first and see if I'm a match. And sure enough, and that's how it all happened. It was more a relief that I was a match. I probably would have been devastated had I not been a match, because he would have been on that waiting list even longer.
Started by 3 nuns in the 1800s, what is now known as the CHRISTUS Santa Rosa Health System opened the CHRISTUS Transplant Institute in 1999. More than a decade later, the institute is among the very top in the nation in transplant patient survival rates. Placing an equal emphasis on both quality health care and highly personalized attention, the institute is determined to reduce the number of transplant surgeries while making life easier for those patients who do receive them.
Yeah, 2005. I got diagnosed with the kidney disease and been treating it and getting good labs every month. And I don't struggle because I want to go on with the normal life as much as I can, with my limitations, of course. But with other patients would do what I'm doing, they'd be in good hands as well. So.
CTI is a department, an outpatient department of CHRISTUS Santa Rosa Healthcare System in San Antonio, Texas. And we work with the patient and the OPO and UNOS to help coordinate the care of those patients that are on dialysis, that have end-stage renal disease, that are in need of solid organ transplant. We evaluate those patients, we evaluate any potential donors that they might have. We do an extensive education program so that everyone is very informed as to what that donation process and that transplant process is, so that they go into the procedure well informed, well educated, and ready to take care of their kidney for the rest of their lives.
To find out more about CHRISTUS Transplant Institute, please visit CHRISTUSTransplantinstitute.org.